Welcome to the Combinations Podcast, the podcast from North Staffordshire Combined Healthcare NHS Trust. And in today's podcast, we're talking about the new Update 5 for PatientAide, which is an application for service users to view parts of their record. I'm Kyle, the Digital Content Lead, and we're talking PatientAide. So let's firstly meet our guests.
I'm Lou Wright, Digital Transformation Specialist working at the Trust.
Hi, I'm Mark Redden. I'm the Head of Digital Solutions for Dedalus.
Hi, I'm Danny Hepworth. I'm the team lead for the devs that work at PatientAide.
Hello, I'm Charlotte Hartshorn. I'm the Scrum Master / Project Manager, and I've been working closely with Lou.
Brilliant. So welcome to the Combinations Podcast. Obviously today we're talking about PatientAide, which is an application. Obviously our listeners will not know what PatientAide is. So what is PatientAide? I'll go to you first, Lou, as you're sort of our representative from North Staffordshire Combined, and then we'll go over to the team that have brought it in to our trust.
Okay, thanks Kyle. So PatientAide is not brand new within the Trust. We have been using PatientAide for nearly a year now, so that was release 4, and prior to that, which I'm sure Mark will tell you a bit more about that was we did launch a version before COVID, so now we're on release 5. So PatientAide is a web application app which you can have on any device at all, so it can be Android, iOS, iPad, you can use it in the library, anywhere really at all. And what it allows the patient to do is once they've been, as we call, onboarded onto there by the clinician, they can view parts of their clinical record that is held by Combined. So if you are a patient of Combined, you can view parts of your record, for example, things like your allergies, conditions. You can fill in questionnaires in there. You can there's a direct link to the portal, the wellbeing portal. You can view your
Appointments.
Thank you, Kyle.
I had a look at the app earlier.
Yes, thank you for that. My mind had gone blank there. But you can also, in My Health, you can also use your Garmin or Fitbit to connect to. So there's lots of parts to it, and that's literally just an overview really. There's all the things as well.
And with the connection with the smart devices, that's like your steps that brings it in.
Absolutely, yeah. So I think everything apart from sleep you can record on there, but you don't actually need a Fitbit or Garmin. You can put things on manually. So if you did want to record your steps, just from a normal, like another watch or something, you can actually put that on there. Or if you wanted to record your blood pressure, things like that, you can do that just manually. It doesn't have to be, you don't have to have that device.
No, there's a lot of depth with the health tracker, isn't there? As you mentioned, you don't have to just connect it into a medical device or an Internet of Things device. You can put it on there with yourself. And there is sleep tracking. I know Danny was eager to get in.
Yes, there is. Yeah, there you go. Yeah,
but there is a lot of depth on there. So.
Yeah.
And does that pull from the data from the phone? Because obviously phones also collect steps as well. It's not just smartwatches.
Yes, it will. Yeah. It will pull from there. So we use what's called a data aggregator service. So you sign up to Validic, and that allows us to connect into the smart devices. But it'll also do medical. So if you're doing blood glucose monitoring as well, you can get specific devices that can track that. And it'll feed into our product, and you can see it within the health tracker as well.
Well, that's just the magic of technology, isn't it?
Yeah, absolutely.
So, but what is PatientAide for you guys? Because obviously you are the team. So.
It's a health and wellbeing product, is PatientAide, and it's something we've been developing for the last 2 years, working collaboratively with the team at North Staffs. We took it from the initial iteration, which was quite clinical, and tried to soften it up and make it a lot more user-friendly. So as you've already touched on, you've got appointment management in the product, and big use cases are in questionnaires and being able to send questionnaires pre-appointment or post-appointment, being able to track things over time using questionnaires. I know you've got the intention to use them for your access planning, care planning.
Yeah, so that it links in with the work that has been done on the new care plan. So there's 2 questionnaires on there that can be filled in that form part of your care plan longer term. So they are on there, and there's also some others and scope to put others on there as well. It doesn't end here. So yeah, that's a really good tool, because the patient can sit at home, they can sit in the library, in the car, wherever they want, fill in that questionnaire in their own time, rather than trying to rush it, perhaps sitting in a waiting room on a clipboard. So they can fill it in electronically and submit when they feel that they need to submit, and it gives you that reminder. The ones that have been completed you can still view, the ones that are outstanding are still there on your little dashboard. So gives you...
as a patient, it's very transparent then.
Absolutely.
So you can, when you've submitted your questionnaires, you can view those as well.
Yeah,
so
you can view the
double check
answers
it
there,
over.
what you've sent in. So if your appointment isn't for another 2 months, you could look at it the night before to remind
Refresh
yourself
yourself.
what you've actually filled in. Yeah.
Can they update them, or is it once it's submitted, it's
once
submitted?
it's submitted, it's submitted. I mean, obviously that's a conversation they'll have to have at their next appointment, and the clinician may push another one out for them to do again. So they can do that. But yeah, once it's submitted, it's in the system then.
Just on that, you can save for later though. So if it was that you haven't finished it, or you just need to think about it, and you can come away and then come back to it and save it, and carry on from where you left off.
Yeah, especially if it's, I don't know how big these questionnaires are, but
pages. Like War and Peace. No, they're not. We try to keep
some are bigger than others. And they're just little radio buttons that you just click in. It's very simple. Whatever the questions are, obviously are just in PatientAide, and then you just go through and, like Danny says, just fill them in your own time, save for later, or submit if you're happy. So that's the beauty of the questionnaires, really, which I think is a really good move forward, because I think with digitally now we're going for less paper. We're linking into the green agenda. So trying to get rid of that paper and be a little bit more electronic.
And everyone has a phone. In
Most
most cases,
people have some kind of device, don't they?
But you mentioned it's accessible from libraries, and obviously
libraries, community centres. It's web based, so there's wherever and whenever.
Because you mentioned it's accessible on phones, but with it being web based, that is PCs and Macs as well.
It looks good on a phone. It looks good.
It's been built so it'll work across any resolution. So whether you're using it as in your internet browser or you're using it on your mobile phone as an app installed, we built it so it feels like it's supposed to work in that way.
Yeah.
But we've talked about, obviously, what is PatientAide, and we've gone through, it's a transparent system for patients to view their details. But obviously you have to be part of a service or team of North Staffordshire combined.
You do.
And you mentioned the word onboarding.
Yes.
And that's obviously, you speak to your clinician. Can you just explain what sort of process a patient would expect if they were going to be chosen to be put on to PatientAide?
Yeah, so we have got a lot of posters and leaflets and what we call the little rip-off prescription pads with the information on. There is a QR code on there that patients can scan, which will take them to the sign-up page of PatientAide. However, prior to that, what we have put on there is that if you do see a post, you're sitting in a clinic and you do see a post and you want to sign up for PatientAide, if you speak to your clinician or nurse, whoever you're seeing, they can actually what we call onboard you onto your main clinical record. So that is quite an easy process. And then from that you get a separate email and a letter which can be printed in clinic or sent to you with 2 codes on, and you pop the codes in the sign up page, set your password, and then you signed up. It's as simple as that, really. Okay,
yeah. And what are the benefits then? Because we've obviously told us what it is and how you access it. What are the benefits of PatientAide? What's in there?
So, I mean, from a features point of view, you have touched on a couple already with the appointment management, having visibility of upcoming appointments. You've got able to cancel those appointments, request cancellation, which is great because it reduces DNA.
Yeah, thank you, Mark. Yeah, that's really important. Yeah.
But just being involved in your healthcare, in like 2024 now, and the NHS apps out there, and people are familiar with that. When we had it for COVID and getting your COVID passports on there, so these aren't new things, and bringing this in and allowing people to have visibility of what's in your health record and being involved in your own care. That's one of the bigger benefits is that with the transparency, seeing what's in my health record, what conditions have I got. You might have an allergy that isn't present in your record because you can see your record now, and you might want to highlight that to your clinician and say, please can we get this in. Prior to turning up to your appointment, you might be sent a questionnaire. We've got media, we've got the ability to send media out. So one of the features we brought into the latest version with Release 5 was say you've got a specific condition, the clinician can actually send out videos and PDFs and documentation around your condition. We can send out notifications. You've got messaging between your dashboard as well, one-way messaging as well.
Yeah.
So it's
just always the like building, isn't it? There's lots of things coming up which we'll touch on later, but you know, there's lots of new and exciting things coming up, isn't there? It's just not going to stop now at release 5. There's other things in the pipeline that, you know, are going to help the patient even more. But I think, for me, I think it's really, in a way, it's really good because there is another part to it that we haven't mentioned, which you can delegate parts of your access. So if you were a carer for, you know, whether it was a younger person or you know, somebody in the older community, you can delegate parts of your PatientAide record to them. So it might be, for example, that you wanted them to fill in questionnaires for you, or you wanted them to, you know, look at your appointments for you, and that can be turned on and off at any point. And you can allocate that. That is your preference. That just sits in PatientAide. It doesn't go back into the main Lorenzo record. That just sits in PatientAide. So if you decided actually that your care had changed, or you can make that change as well.
Would they need a letter as well in its startup though?
They do get a sign up.
Yeah, so the way that we've implemented currently is a delegatee, so someone who's been given access to your record, has to also be a patient that's registered within your trust. That's how we've got it at the moment. And then that person's given access. Further down the line, when we bring in some of the new features like NHS login, we're going to allow it where you don't have to be a patient yourself. You can actually be given access to the record and invited.
Yeah.
So it's coming, we're just slowly growing that functionality as we roll it out.
It's in development, isn't it, that
It
one?
it is in development, but sometimes you don't realise you need to develop it until you start talking about it with your users and going, actually, have you thought about these type of people? I want to use the product.
Yeah. So, and if you and also a big thing within Release 5 is the demographics.
Which keeping up to date.
Yeah, which we've had quite a lot. I mean, we've worked with, you know, we've got a task and finish group which Dedalus are part of, and we've worked with quite a few service managers and admin and people on the ground working with patients day in, day out. And one of the things that was, you know, they thought was absolutely brilliant was for patients to inform you that they'd moved address or changed the telephone number, and they can do that, so they can.
Is it more a prompt though, or is it actually changing the details?
No, what?
And is this to come? This is
this
is now.
This is there now. So there is Danny has set up a prompt. So every 3 months the patient gets a prompt to say, have your details changed? Mm-hmm. However, you can change them at any time. And what happens is that you say you changed address, you would pop in your new address, submit that in. That goes back to the clinicians, what we call in tray. They pick it up, or admin pick it up, and then they change it in Lorenzo. That's the way it works. But we're looking at doing some further development on that in the future, and picking up things like accommodation status, things like that are reported on. That will. And
what demographics is it allowing you to change? What's in the current build for that? Is it mainly address and telephone numbers?
Address, telephone number, email address. Yeah. I think we also capture, if you got name change, you know, you might have got married, so you can send that information back.
So that's what we've got at the moment.
Because it was flagged up. Usually you'd only get that information if the patient comes in to clinic and you ask.
It was flagged up about 12 months ago, I think, when you came last time, that would be really helpful. Because I think what's happening obviously is people aren't, you know what you do, you forget, don't you, that you need to tell everyone you've moved address. So having that prompt every 3 months, you know, even if you forget now, you know, you'll still have that prompt and you can say, oh yeah, actually I've changed address, or my phone number, I've changed contact.
Especially when you do change address, it's kind of in the back of your mind sometimes to
so
change all the addresses. So
sometimes
it's nice. You might be in your new house 2 months down the line, and then you get a little message from the app, and it's you know, have you moved address? And, oh yes, I have actually. And I bet you can tap on that and change that, and off it goes into the in tray.
So that's really useful to have that one.
Yeah. And it's also, we've got text messaging in the product as well, emailing as well around alerts. So if you've got upcoming appointments, if you've got questionnaires to complete, the demographics alert, rather than you having to remember or have it in your calendar, we're getting those text messages out there to our users.
Yeah.
See, and I love a feature like that when something texts you to remind you, because sometimes you don't put it in your calendar and you get a reminder that you got an appointment in 2 days and you're like, I forgot about that. So
you can add the appointments to your own calendar, can't you? So whether you use Outlook or whatever, you can add it in and add that reminder feature as well.
That's right. And if you're going to be doing a virtual appointment using Attend Anywhere, we embed the link, so you can click the link and you can have the video consult.
There's a lot of integration.
We looked at the integrate, but that's what we wanted.
And there's a map, so if your appointment's at the Harplands, for example, and you haven't been there before, it brings up the map, and like Mark says, you've got the ability to have the Attend Anywhere connection.
And I imagine the map integrates with the sat nav on your phone.
It brings up
Google Maps.
Google Maps,
which you can.
Is there anything this software doesn't do? But obviously, we're on update 5. Obviously, that's exciting that you're going to be rolling out to more teams around. But as a project, because I feel like we haven't brought you into it, as a project, how has it gone integrating Project 5 into the Trust?
Well, I joined Mark's team, I think, 2 years ago this month, actually. So I joined Lou, working with Lou on the North Staffs. I think it was release 4. So I've kind of seen it develop from then into the beautiful app that it is today. So but obviously there's been...
there's been some challenges.
That was the challenges face, isn't it?
There are, because when you're bringing a new product through, as Charlotte mentioned, you came in just as we started the work on Release 5 to get in, which was completely different. Because Release 4 we'd done under a different work stream. And this was the first very specific, these are North Staff's features, this is what we want. That's why we've done the combined wellbeing portal. And I know you've done many meetings every week.
We have. Me and Charlotte meet at least twice a week, if not more, or we're messaging each other. There's lots of questions to and answers that need just quickly putting through. And
that's like a proper partnership then,
it is a partnership.
You've worked with many different groups as well. I know you've had like a task and finish group have come in there. We've started working with Naomi and Lauren as well. They bring a different
clinical
perspective.
Systems and lots of, and obviously Leslie's had
because there's a lot in the background of things. There will be a lot of teams that are working on this, because you mentioned clinical systems. Obviously you're digital. We've got to get the nurses on board.
We've been working with Zoe, and so linking in with the care plan, as we've said earlier, so that that'll Zoe has mandated it across the trust. So what that kind of means is that everybody will have can potentially have access to PatientAide, and like I say, the 2 questionnaires that are the 2 new questionnaires will link in strongly with the care plan.
Is that the big feature for update 5, the questionnaires? Because obviously I know how software and systems and even video games work. Updates are big things.
I think it's a game changer.
The 2 new forms, the Requal and the Dialogue Plus, because they're going to be used in your care plan.
Absolutely.
That was a big drive.
So from update 4 to update 5, is there big changes?
Visually, I'd say not as many, but from additional functionality, I'll lose touch on it. We've got the demographics, the ability to send that information back in. We've brought in the combined wellbeing portal. You've got the new CDC forms. We've not spoken about it. We've got a management dashboard as well, which the clinical users can view their patients who register for PatientAide, but send them content, see what content's come back in as well. So that's been updated.
I think the dashboard is coming in the next few months. So we've been working again quite closely on that.
And that's strictly for staff and clinical.
That is strictly for staff. So I think the main benefit for that I feel is that rather than going in and out of each patient's record, you're able to view all your patients on your caseload, as we call it, there. So if you wanted to push out a questionnaire to 2 or 3 of them, you can do that as quickly as
it's just a bit more admin control, isn't it?
Couple of clicks,
It's a better procedure, saves a lot of time as well, doesn't it?
Absolutely, and like Mark's already touched on, you can forward some media through there, so particular
like
leaflets.
from a vision point of view, we wanted it where you could build media libraries. So say you've got a patient with a specific condition, you could build up these videos. We know, because we even wanted to bring in a rating system, like, you know, thumbs up, thumbs down, similar to YouTube. So we'd send it to you as a patient, you tell us is that useful content. If it's not useful, we know that actually we've got 10 people who said this isn't appropriate, and we know it won't be in the final library, and we can build up what actually will be good to send out to our patients.
Yeah. But I suppose really just to touch on the portal link that we've got in there, I mean that's got a whole host of information on, as you know anyway, so that is, you know, a link straight through to the portal so people can view all the topics on there, and obviously
and the wellbeing portal is our system for, well, it's for everybody, isn't it?
It is. It's absolutely
just for any listeners,
you know,
who don't know what the wellbeing portal is. It's a treat, is what I would say.
A wealth of expertise and knowledge that has been, you know, clinically led and clinically signed off. And again, Dedalus have been, you know, a big part of that.
And if you are interested in the wellbeing portal, we have a podcast that we've done previously about that if you want to listen to the ins and outs. But we don't want to take it away from PatientAide today. But it's nice that it's integrated because it's also allowing our other systems to be involved. So
absolutely. And you know, we've, like I say, lots of things on there that, you know, the patient can access free of charge. It's there, it's all clinically been written. You know, we've got other things that Dedalus are working on. I don't know, Mark, if you want the joy of mention about the
I'm happy to talk about some of the, so what we call the roadmap items, things we're looking to bring in.
And is this for update 6?
Yeah, this is update 6.
So I'm getting it now.
We are working on our update 6 currently, and some of the stuff that comes onto the roadmap is driven by conversation we had during that, you know, and it might be too much scope to add into the latest release. We get added into the next one. But we are looking to bring in NHS login. So we've got the onboarding process with invite only at the moment. Your clinician would onboard you into the product. When we bring in NHS login, we're looking further down the line that actually if you've registered for NHS login, you've gone through their security checks, you can actually sign up for PatientAide yourself. You'd be able to do it. That's what ultimately where we want to get to. We're also looking to integrate with the NHS app. So one of the things they want to do is any appointments you've got in your Lorenzo solution will go into the NHS app as well. So you'd be able to access PatientAide from the NHS app, but equally you could log into the NHS app and see items from PatientAide as well. So that's really key integration across all these different systems. And we're looking at bringing in appointment scheduling. So at the moment we allow a patient to cancel an appointment. What the scheduling is going to do, it allows you to see options for appointments and actually request a reschedule as well. So again, we feel that sometimes you might get given an appointment, can't attend, but if you had visibility of what's coming up,
would you be able to book it from the app there?
You could request to book, because we've still got to consider the clinician.
Well, of course. But I think also that's adding an element that you don't really think about in terms of like anxious patients who don't want to use the phone or go into the clinic. They might be able to request an appointment, and if that's developed where it can just be accepted and they get an email receipt, you know, that could, it's not an issue, but it's something that it's nice to think about some patients that would struggle with that.
Absolutely, and I think the task and finish group will be quite a big part of that, kind of moulding that into something potentially that could go forward. Same with, I mean, the NHS app we've spoke about for a few months now, haven't we? And that's, you know, that's definite.
And I've used the NHS app, and
I think
I've used it from time to time, and I was like, oh, there's my appointment. I know that's obviously for the GP on that one, but it was. If you can see the benefit in that, and if you've used the NHS app, then this is where obviously for the PatientAide side it's going to be just as useful, if not better.
Definitely.
It is. And further down the line, you know, we speak with NHS frequently because we're doing the integration rollout at the moment, and they want to grow what they're doing, and some of the features we've already got in PatientAide, so access to test results and access to questionnaires, they want to bring into the NHS app and allow that integration going through as well. So we're kind of a little bit ahead of the curve with that one. Another one we're looking at is something called virtual wards. We're looking at this kind of grouping of patients and being able, so from within the management dashboard, being able to create groups of patients and then being able to, you know, mass mail all these people and say, we think this content's appropriate, we might have an event coming up that we can let you know about, everybody, can you please check your demographics? Just, being able to create groups and make it easier for the system.
They sound like big wards. You're saying groups of people. I think of our wards and they're what, like 12, 18 beds, but are you talking like hundreds of people in these groups?
At least it'll be up to the team and our staff say they want to use it, but it's come out of like discussion, because at the moment it's on a granular level. You can manage your patients, it's on a week. But if we want to create groups and be able to send content to groups of people, we're also, because one thing we want to get to down the line is remote monitoring. We touched on the smart devices earlier and being able to record blood glucose or steps, or look at we do mood tracking as well. Being able to provide that information from a smart device through and put it onto the virtual ward. That's something we want to look at. There's a lot of work involved. You have to go through specific certification, but you've got to have ambition, haven't you?
Yeah, definitely. Definitely.
What I like about the way that we work, so we're talking about a roadmap, we're talking about version 6, and we're saying like, this is the plan for version 6. But the way we work isn't, okay, that's the plan, and at the end of version 6, that's exactly what it will look like. Because we have an agile approach to how we work, it means that sort of how those things come into light. I really like the involvement of like the sort of teamwork between North staffs and the devs. We are quite close because we do communicate quite often. So how we implement these things, we get feedback all along the way. It's not, okay, we'll decide now and build that, and then if it didn't work, it didn't work. It's every point throughout the process, we involve everybody gets involved, everybody has an opinion, to make sure that when we do build this stuff, it's the best it can be and that everybody's happy with where it's got to as well.
Because with us being first of type,
it's exciting.
It is very exciting, but I think we've been able to mould it a bit for the trust, but we have to think that potentially this could go out to other trusts, so we've obviously got to be realistic about kind of what we put in. So it might be that, like Mark's saying, the virtual wards longer term might work for us quite differently than virtual wards at an acute, for example. So we try to be reasonable in our approach, because obviously it's got to be user friendly for
and the feedback we get along the way. I know, for instance, one of the features we brought in was the ability to look up conditions against NHS A to Z, and it did it automatically. So if you had a condition, broken leg, it'd go and look up. But we found that it was bringing back not just broken leg, it'd bring back, if you had the word broken in, which when you're dealing with clinical things, you didn't want to confuse the users. So rather than put something out there where we might get some negative feedback, it was just, let's take it out for now, let's refine it.
That's something we need to work on. We might just put in it was brilliant, and like say for some conditions it linked completely straight up with, which was fine, but then obviously some of the conditions it didn't quite link up, and
so are we talking from the clinical system side to the PatientAide side?
So it's how we like Mark says, we could put broken leg in our clinical system, but actually on the NHS website it doesn't say broken leg, it might say broken limbs or something.
Is it because of the system they're using? Because obviously there's Snowbin and ICD-10 in system. Is it anything to do with the clinical dictionaries, really?
I think it's what it's using as search terms. So I've got an example here. So for example, like in this case, there's like chest pain is my condition. It's using the word chest to search for the NHS website, and it's coming out with chest infection and chest pain. So it can be a bit misleading if you're not sure what it is that you're looking for. So it's how it's querying.
And I think the general thought behind it was that rather than patients going on and Googling all sorts of things, it would be a direct link to the NHS website. So potentially now we're probably thinking, well, maybe we just put the NHS website within the conditions area, so they have still got that direct link, and they're not Googling. But again, that's something that we'll be picking up later on. But
well, that's kind of what Danny and shows, because we've got this agile approach, and it is feedback continuously throughout
all the time.
We can, and we work on what's called Scrum Agile where we do 2 weekly sprint, isn't it?
Yeah,
So
that's right,
every
yeah.
2 weeks we're doing a new release of the product internally and we'll put it through testing. So if there's anything that comes out of that, which actually we're not quite sure on that,
Yeah.
it's not worked for us,
Yeah.
we can refine and change. So even though the roadmap might be here, there's no reason we can't bring new features in, because once it gets out there with your users, which we're hoping to do, you might get some feedback, because we did get some lovely feedback. I know you during release
We did.
4
We had
really-
a patient at, I think it was neuropsychology, that did us a lovely report,
Yeah,
really,
it was really good.
based on and giving us, kind of the thoughts of all round. They kind of reviewed the whole PatientAide app and give us some really good feedback, really good thoughts about, as a service user or patient, how they see it. And there were some things we picked up in there that, things to work on, things to look at. So we're hoping that we can get more of that, and also hoping to do kind of a case study later on as well. Just to,
So it sounds like it's community developed then, if people are getting involved.
That's what it's all about, isn't it?
And it's both patients and staff. And obviously your meetings, I guess that's brought up the feedback between you pair when you're feeding back to it.
Yeah,
and I bet there's features you've tested that haven't made the final release that you just think, it's going to be a bit of a game changer.
Well, it's the same sort of environment within our inner circle as well. Like the test team, I'll have much as an opinion as the developers, as Mark, as myself. It's like if someone's got a great idea, we'll listen to it, and it don't matter where it's coming from, and we'll think, is it good? Is it good? Okay, it turns out it wasn't. Yeah, but we've tried, and I think it's a good approach to make sure that we just make the best app we possibly can for the users that we're aiming.
And between update 4 and 5, has there been any game-changing features? Have anyone got anything that you think, I would never go back to update 4 because update 5 has this?
I think the new CC form, the new forms,
the links
they're
to
very,
the
very
care,
important.
the new care.
And is that because it's a big feature, it gives control to the patients?
It's delegated access.
Yeah.
That wasn't in release 4, and
No.
now the ability
So
to
this is
give
what I like to
somebody
hear.
else.
I like to hear the upgrades, the changes.
I forgot the delegated access wasn't in release 4.
Yeah.
That's quite
And
a
the
big
ability to give someone access to your profile and control it, because sometimes you might have it where you give them carte blanche, they can see everything, but we've made that granular approach. So if you don't want them to see appointments, or you don't want them to access conditions, but you do want them to be able to complete a questionnaire, you can do that individual turn off of little items within the full profile, which is really, really good.
But also with it's not just for carers as well. There's that element of if the person can't read and write very well, it's that giving access to sometimes even the children. They've got sometimes maybe a better reading ability than the parents or whoever they're caring for. So having delegated? Is that added? Again, it's all about that transparency, isn't it?
And I think it's good because it's managed quite well. So it isn't like here's my phone, have a look. It's all like managed. So you as the patient have got to give them access. You can control it. You, like Mark says, you can switch items off. You can actually revoke the whole access. So if something changes and you don't want them to have access anymore, that's an option. But it's all in your gift, really. So it's giving the patient a little bit of control and kind of say of how they want to share that information. I've met with a couple of clinicians recently, and I probably haven't even told Mark this yet, but because we haven't had time.
It's exclusive.
It is exclusive yet. No, there's lots more ideas that have come out of discussions that potentially could go in further releases. Like a further extension on the mood diaries. Things like that, really. So again, that's something that we'll put in the pot.
And is mood diaries out now, available?
It is. It's in the health tracker. It could do with working with a team at North Staff.
We've got
because
other
I believe
ideas
with the mood tracking, it's got a place, hasn't it? Because some people want to track their moods, and I think having a place on PatientAide to keep it securely is what you want, because some might leave it in their notes, but if they've got it there, it's sort of backed up, it's always there.
Absolutely.
So
and I think with the My Health area, that's something again that the patient has got complete control over. They can share it with the clinician at an appointment, so it isn't shareable through their clinical record. It doesn't go into their clinical record. So if you've been, say, counting your steps and tracking your mood, and it's something that you spoke to your clinician about, you can bring your phone or your iPad, whatever, any device, and actually show them on that clinic appointment, you know, I've been tracking my steps, and, you know, I've been doing really well, or, you know, kind of setting those targets. But it's something that's completely in their gift. If they don't want to use it, that's absolutely fine. It's there as an optional extra.
It is, but it's nice to have, because some people don't have a smart
No, and you can do it manually,
manually,
so you don't need a smart device of any sort. You can just put it in, you know, as Mark's just said.
And obviously with steps, the phone does that for you. You don't have to count them individually.
I think Charlotte might physically count the steps.
You said that earlier. You're like, yes, more steps.
More steps.
Yeah.
So,
And SMS, text messaging wasn't in release 4 either, which it's a really good feature to bring in.
I bet you're thinking now, you know, what was update 4 without these features?
Yeah.
And that's what I like about development, because obviously, how big was the gap between 4 and 5? Was it 9 a year? You know?
I think we launched it in April last year, release 4, so you know.
So it's had a lot of development.
Yeah.
And you can tell by the new features that you know, if this is a keynote, they're the crowd pleasers, aren't they?
Yeah.
But as a project as a whole, has it gone well?
Yeah.
Is it working? Are we all happy?
I think it has gone
Yeah,
well.
definitely.
I think there's so much potential in it still. You know, we've worked on it for, I mean, you know, our team have been working on it for just over 2 years.
Yeah.
And we've got it to sort of almost like a base level. Like, we've talked about the tracker. We've introduced the tracker. Yes, you can add and you can integrate with Validic, but there's so much potential, like going a bit further with the mood tracking, like journaling, for example, is possible. There's so many ideas that are still available. And delegated access, we've talked about that. Working on top of what we've already got, so it's not just patients, so you can send it to other people. It's exciting where it's going from my perspective as a developer. You know, we've talked about like roadmap and, you know, sort of monitoring the mood and AI as a potential thing that we're going down in order to sort of make care easier for us to understand the patient's sort of medical journey. It's just, I think it's I'm looking forward to the future.
It's exciting.
There's a lot here, isn't there? I think
absolutely.
well, we've heard the roadmap, we've heard the NHS integration, and obviously they're big steps are what you've got to come in version 6 or update 6. We could probably do another podcast on, because
we haven't even touched on the AI stuff, have we?
No.
Really, obviously Danny's just said, so
so we're looking to do a knowledge transfer partnership with Huddersfield Uni on bringing AI into PatientAide. It's very, very early stages yet, so we put the proposal forward in December, and it's to be used by the clinical team rather than the patient side of things. It's to support, we're looking at let's say, but I think one of the examples was vital signs, so being able to use the health tracker data to see how vital signs might play into other conditions as well, so
it's a bit like early intervention, really, isn't it? But we, like Mark says, we're very early days yet. We're hopefully by the end of February we'll have more, and that might be a separate podcast altogether. But you know, with Huddersfield Uni as well. So
I think AI in itself should be
absolutely, it's just amazing. But that's very exciting.
It is, you know, because we've been looking for an opportunity to bring it into the product. We've got a lot of metrics, but not just in the PatientAide product, in your Lorenzo as well, and it's how can we marry up all this data that we've got and actually make some informed decisions, or you know, even nudge people in the specific direction and say, look, this is what this is showing, take a look.
But I think with AI as well, that's current technology, almost futuristic, because we're not utilising it as much. It's obviously come out into the public sector for people to use, but like, you know, to utilise AI along with these current integrations and smart apps, it really shows that PatientAide is like very current, almost futuristic patient records, isn't it?
And I think this is just the beginning.
Yes.
You know, like Danny's just said, there's lots more things. The guys are always coming up with ideas. And sometimes you think that's quite crazy, but then when you actually drill down, you think actually that'll work. Or like Mark says, sometimes they don't quite work yet, or not how we work as a trust.
And I think as a mobile device, honestly, I'm big into technology, but
Yeah.
as from a mobile device, it's you customize it how you like. Every place almost has an app now.
Yeah.
So, and if you care about your health and you want to get more involved, this is where this app sits. Really, it's for you to access. And you mentioned journaling, which means it's going down also a mindfulness and well-being side of things as well.
Yeah, I mean, we are working with me and Leslie are working with 3 community hubs, if you want to call them that. Again, we're doing a lot of work around PatientAide with them, and also the wellbeing portal. So that's all.
And that's it. It's got that clinical drive to it as well.
Yeah, it has, absolutely.
So we bring content to you guys, and then you guys develop it in a way that can be accessed, like the media and the dashboard.
Yeah.
So.
And the more feedback we get from patients, you know, people on the ground using it, and also clinicians, the more ideas that the guys come up with. So it's always, you know, it's been literally living and breathing PatientAide, hasn't it, for the last...
It's been a...
How do you guys sleep at night now? How exciting it is!
Dan sleeps better now it's gone live, Bob.
Dan can sleep now.
Yeah.
So it's... but yeah, there's you know...
So update 5 is out.
Update 5 was live yesterday. Yeah, we're.
How much rest are you going to get before update 6 is going to take over your life?
I think Charlotte started writing the plan already.
No, I don't think we're constantly kind of talking about new stuff. We've already, like Mark says, we've already got things in the roadmap, and that's just like, you know.
I don't want to even see update 3. The growth that it sounds that it's had, and I've obviously played around on the test version earlier, and it was very sleek. So
yes, it is. It's very just one click, and
It was really important though. You know, we wanted that UI and user experience to feel really familiar. You know, so if you've used a modern health app, Apple Health, it's going to feel familiar to you for navigating around. You know, and
it's not a problem having both either, because they're all going to integrate from the same similar amount of data, so you don't have to worry about picking one or the other. You know, this one is designed obviously for your health around North Staffordshire combined, but if you still want to use your health apps on there, it's obviously with the integration the data will be added between the apps and synced really between them. So
yeah, definitely. I think it's just the start.
It is.
I think that's a great place to end as well, with it being just the start. I've really enjoyed this podcast. I think I hope the listeners, and if you are under any of our services, you know, you can find out more from speaking to your clinicians, and it will be being rolled out. But as where it's at, it's a good place, isn't it? Really, there's a lot of development. It's very easy and accessible.
Absolutely.
The delegation mode also is probably a big seller.
So watch them posters going up in the clinics. There'll be leaflets coming out. There's, you know, all the communications coming out. Oh, I must mention as well, there are videos available for clinicians and for patients on the website.
We can link that in the description, so if you're looking for those, there'll be a link in the description
brilliant.
For that. Is there anything from the team you want to mention? Obviously, I know update 6 is coming and we've talked about the roadmap, but is there anything else you'd like to finalise the podcast on?
I think we've covered, you know, we're not just stopping here, we've got lots more to come.
Yeah, absolutely.
And please download the product.
Well, it's been lovely to have you all.
Cheers.
And so thank you very much for listening to the Combinations podcast.